So my name is Dr. Mary, and today I'm joined by Dr. Anastasia Stocker. And today we're going to be discussing post-COVID syndrome. So post-COVID syndrome has been in the news a lot recently, and with the sheer number of people the that COVID has affected, we've seen a lot of it in practice. And there are a lot of vague symptoms and kind of widespread pathology associated with post COVID syndrome. So it can be very confusing to understand as a patient and, frankly, as a doctor as well. As a medical community, we're still sifting through the data, coming up with new data, and kind of trying to get a grasp on how to support people with long COVID. So today, what we're going to do is distill some of the key points of post-COVID syndrome. So what it is and what to expect with it, and then we're going to go into some of the causes of post-COVID syndrome, and specifically, we'll go into some of the manifestations that we're seeing most often in practice that's not considered, the more common symptoms of respiratory respiratory compromise and fatigue and headaches and that kind of thing. Um, and then we'll go into some simple protocols that you can do before you get COVID, when you have COVID, to prevent long COVID from happening in your body. And then we'll go into some specific ways that you can support yourself with post-COVID syndrome. Within post-COVID syndrome, there's manifold ways it can manifest in your body. And so we are going to go through a few examples of how we would address it, but the treatment plan for post-COVID syndrome versus the prevention of it is going to be a much more individualized process. So keep that in mind as we go through the presentation. And also keep in mind that some of the treatments we'll be discussing, the evidence that we are basing our treatment plans on is from research on other viruses. Because, again, it's only been a few years since COVID has become a major pandemic in our world, and we have a lot of catch up to do in terms of high quality randomized controlled clinical trials on a lot of the therapies that we're going to be discussing. So many of these therapies will apply to similar illnesses that we've seen crop up prior to the COVID-19 pandemic. So again, my name is Dr. Mary Schroder. I am a naturopathic physician and acupuncturist, and I practice both of those modalities at ARIA Integrative Health. And I am also doing pelvic floor therapy at ARIA Integrative Health, in addition to traditional Chinese herbal medicine. And today I'm joined by Dr. Anastasia Stocker, and she is also a naturopathic doctor and acupuncturist, and practices both with a focus on autoimmune conditions. And she also has a really amazing modality that she employs called visceral manipulation, which is a gentle abdominal massage. And we can discuss the relevance of that to some of the digestive manifestations of long COVID that we'll get into later. All right, so first off, I'm going to define long COVID. There's many names for this condition that you may have seen out there. We have post-COVID syndrome, long COVID, and long hauler syndrome. And the definitions are evolving. This is all very new. And again, the medical community is really trying to get a grasp on what this is and how do we codify the diagnosis and treatment of this condition. So, according to the World Health Organization and the CDC, um, it is defined as, so post COVID syndrome is defined as having a broad range of symptoms. Um, it is developed during or after COVID-19 and continues for over 2 months since the onset of the illness. It can have an impact on the patient's life, and is not due to an alternative condition. Those caveats at the end are because, again, some of these manifestations of long COVID can be pretty vague and can be related to many other conditions like headaches, like fatigue, and things of that nature. But one of the things that we really want to pay attention to is the timeline. So with acute COVID-19, you'll see symptoms of the virus lasting up to 4 weeks after the onset of illness. And if it goes beyond 4 weeks, then you want to consider whether or not you are a COVID long hauler. So some of the major symptoms that we've seen across the world include fatigue, shortness of breath, chest pain, and cough. So these are kind of the main things that we'll be looking out for post-COVID syndrome. There's so many other symptoms, however, that have cropped up, including anosmia or a lack of smell, joint pain, headache, dry mouth and eyes, runny nose, poor appetite, dizziness, muscle pains, insomnia, hoarseness, hair loss, sweating, diarrhea. So as you can see, symptoms can crop up all across the body. And one of the it's the actually kind of interesting things about this condition to me is that it really depends on your personal physiology, what symptoms you've struggled with before, and the way that these conditions manifest really highlight how different we all are physiologically. We also will see psychological symptoms, including anxiety, depression, and PTSD. And then cognitive symptoms, including poor memory, brain fog, and decreased concentration. And then one of the big things that we think about is the increased risk of cardiovascular events, particularly in folks who have a history of cardiovascular disease, but not always. So that'll include stroke, heart attack, inflammation of the heart and of the pericardium, which is the sac that surrounds the heart. So the prevalence of long COVID is under great debate. Some studies suggest that the rate is as high as 30%. And in one large clinical trial or one large observation study, they found that the rate was 7% overall and lower for those not hospitalized. So that's a little bit more optimistic for us. It's still unclear if long COVID can develop after an asymptomatic infection. So available data so far suggests that it's a very small portion of the population that go on to develop long hauler syndrome after an asymptomatic infection, but it is possible. So let's talk about the effects of different variants and on the effects of vaccination on the likelihood of getting long COVID after a COVID-19 infection. So the data suggests that the Delta variant may lead to more persistent symptoms in comparison to Omicron. And overall, we've seen that the prevalence is starting to wane with successive variants. Now, it is very unclear whether or not this is due to vaccination rates or due to a change in the virology of the virus. So a change as it's evolving, in our bodies and in our population. Is it getting less virulent? Is it leading to less long COVID? Or is it because more and more people are vaccinated? We're really not sure about that yet. So the effects of vaccination are also greatly debated in terms of, if you are vaccinated with 2 doses and then boosted, is that going to reduce your risk of long COVID? So in one large study with 13 million people, they found that vaccination only reduced the risk of long COVID by 15%. Now, it's really important to remember that the major goal of the vaccination is to reduce the severity of acute COVID, and we do see that playing out across the population. So this is not to say that, there's a small benefit to the vaccine, but in terms of preventing long COVID, it may have a small effect. However, in another large study, they found that 2 vaccine doses cut the risk of long COVID in half. So again, we'll really need to keep our eyes on the research and keep updated because this is a large unknown at this point. So let's talk recovery time. When you have long COVID, the recovery time and whether or not you'll see an improvement in symptoms is really going to depend on your personal risk factors prior to the COVID-19 infection, and also the severity of your acute illness. So we'll see people with certain comorbidities such as diabetes, cardiovascular disease, a history of COPD, and things of that nature having a longer time to recovery. And also when the condition is severe enough, when the acute COVID case is severe enough that a patient has to be hospitalized, they tend to have a longer recovery period up to a year. But again, we're still kind of figuring out what that timeline looks like because many people haven't gotten to a year past COVID yet. All right, so some of the causes of long COVID. I'm going to hand this off to Dr. Anastasia Stocker to explain these.
All right, so the causes of long COVID are not completely well understood, at least in the literature. There's lots and lots of theories around what's the cause, and we can make some assumptions based off of what we know other viruses do. And we know that post-viral illness has been going on probably since viruses and humans existed. So we have some information. It's just very new with COVID. So there's ideas around widespread inflammation. So we know that the virus is entering our cells via these ACE2 receptors that are found throughout the body, in the lungs, cardiovascular system, in the gut lining, and in a lot of the endocrine organs. And this widespread inflammation causes this, what we call a cytokine storm, leading to just inflammatory changes in the body that can kind of persist even after the acute phase of the viral illness. And then we know that this widespread inflammation can cause changes to the microvasculature, causing damage to the cells in the cell wall membranes of the vessels, leading to things like microthrombi or microclots that a lot of people have heard about. And then there's this theory around the reactivation of other viruses and the inflammation caused from having COVID cause reactivation of viruses, in particular EBV. There are some studies into the reactivation of CMV, but those aren't as well established as the EBV. But we do know that both EBV and CMV are viruses that are in the herpes family, and they just persist in the body. and they can go kind of quiescent when the immune system kind of puts them to rest and they don't have effect on people. But we know this inflammation can cause a reawakening of the EBV viruses, EBV and CMV viruses that can cause things like the chronic fatigue and other symptoms that we're seeing a lot with post-COVID syndrome. And we're knowing that this inflammation is probably starting early in COVID disease activity. So like right when you get the acute viral illness, it's probably causing the inflammation to occur to kind of cause the immune system to not pay attention to the EBV virus, allowing it to kind of reactivate and create havoc. Then there's the theory around a chronic viral infection, the idea that your body does not get rid of the COVID virus, kind of similar to not being able to get rid of the EBV. There's a lot of studies that support the hypothesis, while others argue against it. It's really just kind of widely debated at this point, and we don't really know if there are any COVID reservoirs in the human body. The next slide is going to kind of, it's similar to what I just said, but those that like pictures, I'm also a little bit more visual, so I think it's a really good visualization of what we see. Awesome, thanks. So we know that there's this wide ranging in symptoms in long COVID, and we can kind of see what happens. So we know we have over here on the left, the acute COVID infection, the idea between viral persistence. We're not sure about that one. We do know that a lot of it causes dysregulation of the endocrine system because there are so many of those ACE2 receptors on endocrine glands, which can cause damage. And then there's genetic and epigenetic factors. And then we'll see a lot, and we'll talk about this a bit, autoimmunity and immune dysregulation. And then the persistent organ system dysfunction. And like Mary had talked about, we're seeing this in a lot of people with pre-existing dysfunction. And this is why we're so often seeing long COVID affecting the systems of the body that are a little, maybe your weakness. So maybe you tend to always get X, Y, and Z, and then we're seeing that in long COVID. Okay, so some things that we're seeing clinically in office all the time are digestive manifestations, thyroid dysregulation, a lot of irregularities to the menstrual cycle, brain fog and fatigue, headaches and migraines, and then like I mentioned, some autoimmune conditions, both new onset and worsening of previously known autoimmune conditions.
All right, so in terms of the digestive manifestations of long COVID, one of the major things that we've been seeing is worsened irritable or inflammatory bowel disease. So this is an inflammation of the GI tract. They're autoimmune conditions. You may know them as Crohn's and ulcerative colitis. And this is one thing that, if you have a history of these conditions, it'd be good to reach out to your doctor and have a game plan and just kind of consider the going into get an evaluation if you do have COVID or start to have worsened GI symptoms after the acute infection. We also have seen large-scale alterations in the gut microbiome after COVID. As you can see on the right-hand side here, there's many complex interactions between the gut microbiome and the nervous system and the immune system. And these play a really big role in our gut function and many other factors in our health. What we can see with this, so on the right here, we have COVID-19 disrupted microbiome. And one of the things that you'll see is altered GI flora. So the beneficial flora are lower. There's a compromised mucosal system, where the actual kind of gut lining is becoming compromised, more damage to the actual gut mucosa, and that can be from widespread inflammation. We're not entirely sure where the sort of pathology starts at this point. But this can lead to disrupted tight junctions between the cells that line our intestines. And as food particles and bacteria have more interaction with our immune system, that can cause a, um, a, a sort of miscommunication and also increased inflammatory response within the lining of the GI mucosa. So again, largely what we're seeing is this enrichment of opportunistic infectious organisms, often following the depletion of beneficial gut microbes. So if you're having long-standing digestive symptoms after COVID, so increased abdominal pain, diarrhea, constipation, mucus or blood in your stool, it's a good thing to come in and talk to us or another healthcare professional and see what's going on. You may want to consider getting a microbiome analysis, and with the comprehensive stool testing, you can analyze your microbiome and look at markers of digestive secretions and GI inflammation. So really good things to look into if you're experiencing those long-term symptoms. So next I'm going to get into the endocrine disruption following COVID. And so during an acute COVID infection, the virus enters cells via the ACE2 receptors. And these are found all over the body. They're very prevalent in the vascular system, which is one of the reasons why the virus can be so widespread in its effect. And they're also found in the hypothalamus, in the adrenal gland, in the thyroid, testes, pancreatic islets, and also a couple of other organs here. So if you'll look over to the right-hand side, we'll see that there are ACE2 receptors and hence some compromise that can happen after a COVID-19 infection in the pituitary gland and the central and autonomic nervous system. This can cause symptoms of fatigue, headache, altered sweating, dizziness, and autonomic dysfunction. And then we'll see a lot of thyroid manifestations that Dr. Stocker will address in a couple of slides here, and then changes to adrenal function as well. And that can really affect our energy levels, can cause dizziness when standing up and can sometimes cause weight loss. And then there's also a piece on the left here looking at the pancreatic system. The pancreas has to do with our blood sugar regulation, and so effects on that organ can cause a late onset diabetes, which is a kind of less common form of autoimmune diabetes, or kind of post-damage form of diabetes. And then we'll have worsening of a previous diagnosis of diabetes as well. And then we'll also see a lot of effects on the reproductive system, and I'm going to discuss that here in the next slide. So one of the things that we've heard over and over again are that folks are having menstrual cycle changes after getting an acute COVID infection. So clinically, what we've seen is increased irregular periods. So rather than cycling regularly on a sort of 26 to 32 day cycle, people are having really short periods or really long periods. We're seeing an increased clotting, so increased clots with menstrual flow, and then worsened PMS, so worsened mood symptoms and cramping prior to menses. So I, was doing some research on this for this doc talk, and really the data surrounding long COVID and menstrual cycles is very limited and unclear. It was very hard to find pretty much anything at all. There was more information on menstrual cycle changes after the COVID-19 vaccination, which is interesting. But again, clinically we're seeing this, but the research hasn't seemed to catch up with that yet. But mechanistically, if we think about what we call the HPO axis, this is something you can see on the right over here. There's an incredible amount of communication between the hypothalamus, the pituitary gland, and the ovaries and testes. And they communicate via these hormones such as GnRH and LH and FSH. And on the previous slide, we saw that the ACE2 receptors are present in each of these organs. And so we can kind of guess at why there is massive endocrine dysregulation in some individuals when they enter a long COVID phase. And this is largely mediated via these relationships, as well as the relationship between the thyroid and the reproductive system. So hypothyroidism can often lead to irregular menses as well, and as well as any adrenal compromise. So some of the precursor hormones to our major sex steroid hormones, like estrogen and progesterone and testosterone, come from the adrenal gland as well. So each of these systems can be impacted. And when someone comes in with these complaints, I'll often do comprehensive hormone testing. And the purpose of that is to kind of get a sense of where are we seeing this disruption? Is it in the thyroid? Is it coming from higher up in the brain? And is it coming from the adrenal glands? So it's good to think about all these possible causes as the underlying cause to get at the start of the healing process.
Okay, so fatigue and brain fog are definitely probably the number one symptoms that I'm seeing come into the office, especially in the weeks and months following having an acute COVID infection. And in the literature, we're seeing that 1 in 3 people experience fatigue for up to 3 months or more after COVID. That's a lot. That's like 33% of people who are getting infected with COVID having long-term fatigue, and then 1 in 5 people having cognitive impairment for just as long. So there's a couple ideas around the causes of this. And again, it's this low-grade chronic inflammation, and specifically neuroinflammation, so being in the brain, that is created by the COVID virus. And then, like Dr. Mary was talking about, this widespread endocrine disruption. And what we're seeing a lot of the time is this hypocortisol level in people that maybe had normal cortisol levels prior to having COVID. They're now having very low cortisol levels, which leads to fatigue. Cortisol, many people just know it as our stress hormone, which it is. It's secreted when we're under stress in our bodies, in that fight or flight response, running from a bear, or just general stress in our everyday life. But it's also what we call a diurnal hormone, which means it is excreted at certain times during the day, which is very important. It is should be highest about an hour before you wake up. It's starting to increase and go up, and it's increasing during the day. It's what helps get you out of bed in the morning and get you going. And then as it goes, and then it peaks during the day and then starts coming down at night. And so you can fall asleep at night. So when we're seeing endocrine disruption, and we're seeing this higher up in the hypothalamus, so we know that COVID is doing one of two things. It can directly cause damage to the hypothalamus, decreasing the amount of oxygen that's getting to the brain, the hypothalamus, and the pituitary gland, leading to decreased production of ACTH, which is this hormone that is coming from your brain to go and talk to your adrenal glands to create cortisol. So when there's really low cortisol levels, you just have chronic fatigue because you don't have that hormone that's telling your body to get up and go. COVID can also creates amino acid residues that cross-react with ACTH and cause the antibodies that your body is making to fight off COVID to react to the similar amino acids that are on ACTH, and leading to the destruction of ACTH, which means that the ACTH is never going to the adrenal glands to make more cortisol, leading to lower cortisol levels. So there's a lot of things you can do. You can do salivary cortisol testing, so you can establish a diurnal curve for yourself to see what that looks like, seeing if you're having really low cortisol in the morning when it should be kind of the highest, or if you're experiencing fatigue later in the day. We often see low cortisol in the day compared to what it should be. And so it's really interesting that that COVID is affecting cortisol levels on so many different aspects, that it can directly damage the organs that are responsible for creating these hormones, or it can cause a cross reaction and just deplete the hormones altogether. Okay, so thyroid disruption is also just a big one that's coming into the office all the time. The studies on thyroid and COVID are just all over the place. They're very contradictory. One study says one thing, the other says the other. There's no big consensus within the community about what we're seeing. But what we are seeing in office is that there's an increased incidence of Graves' disease, and this is autoimmune hyperthyroidism, meaning your thyroid hormone is too high. And we're seeing this both following vaccination or COVID infection. And this is in people that had previously no known thyroid disorders. There's also an increased incidence of thyroid antibody elevations following COVID in both people that have Hashimoto's and Graves' disease. And this is affecting all of the antibodies across the board. And what we're seeing really is a rise in the antibodies within 1 to 3 months post-infection, and they start to decrease over time, generally over a 6-month period. In Hashimoto's thyroiditis, which is this autoimmune hypo or low thyroidism, you generally have TPO antibodies, and those ones are kind of the antibodies that we're seeing respond to infection and post-infection the quickest. So they tend to rise really quickly and then go down over time much faster compared to thyroglobulin antibodies, which is another antibody that some people with Hashimoto's have. And that one is taking a lot longer to return to normal. It's so where a TPO kind of rises and falls really fast, this TG antibody goes up less, but then takes a really long time. And we're seeing months and months and months, and it's slowly recovering. And then similarly, there's other antibodies in Graves' disease. TSI, or thyroid stimulating immunoglobulin, tends to be the one that kind of rises faster, but it's still taking a long time for it to fall. And there's just many things that we have to consider when it comes to the thyroid disruption, but we know that COVID is causing these changes in antibodies and the thyroid function. So if you've never had a thyroid disorder and you just start to feel some symptoms after having COVID, things that it could be are both hyper or hypothyroidism. So in hyperthyroidism, generally what we're seeing is increased anxiety, palpitations, weight loss despite eating the normal amount of food or even eating more, diarrhea, intolerance to heat, so feeling hotter when other people are maybe comfortable. And then in hypothyroidism, kind of the opposite symptoms, so constipation, depression, fatigue. Both Graves' disease and Hashimoto's, though, can have aspects of fatigue. Generally in Graves' disease, your metabolism is just working more and more, so you kind of get a burnt out feeling. And then you also have some disruption to your sleep, so you get fatigue for that reason. And in Hashimoto's, your metabolism is just not moving as fast, so you feel fatigued for just not having the your metabolism working as well as it should. So if you notice any of these symptoms, it's a good idea to just get tested to see if there's been any disruption in your thyroid, both hormones and any antibodies that might have popped up. Okay, and then again, migraines and headaches. This is they're the most common neurological manifestations of post-COVID syndrome. And they kind of depend, everyone has a little bit different experience when it comes to the headaches. They can be both one-sided or switching sides. They can be throbbing or dull. They can have the classic migraine features that you think of: sensitivity to light and sound, nausea, vomiting, and a worse headache when you're moving and doing things. The most common types of headaches we're seeing are chronic migraines, migraines without aura, so without that kind of sensation of knowing you're going to get a migraine coming on, and then tension type headaches are the most common. And this is where we're seeing a lot of research behind the microthrombi or the microclots leading to increased inflammation and pain. The clots kind of obstructing the vasculature in the brain. And so when blood flow can't move through that area well, it causes things like headaches. And then we know that those microclots are causing damage to the endothelial layer, which is that layer inside the vasculature. And like I said, just causing changes to the vascular function. And then there's also a lot of research around these cytokines and the cytokine storms that we were talking about a little bit, that cause inflammation during an active infection and causing activation to the trigeminal nerves, which are part of your cranial nerves that come out across your face. There's 3 of them for tri on the upper, middle, and lower face, causing migraines and headaches because of that activation of those nerves. And then we're seeing, so for the tension type headaches, there's structural changes just from having a lot of inflammation in your body. And these are the headaches that are often responding well to different types of physical medicine. So things like physical therapy and posture training, acupuncture, or even like chiropractic adjustments. If those haven't been assessed for the structural changes, it's really important. Along with all these symptoms, it's really important to realize that it's a big care team that often has to be created with someone that's experiencing post-COVID syndrome, because there are so many different organ systems being affected, and we need to rule out organic causes of disease, meaning that there's not some other underlying reason why you're having migraines or you're having disruption in different systems. So it is really important that if you are having migraines and you are having headaches, that you get assessed. We make sure we don't need to do any sort of imaging or things like that to make sure there is no other reason why you're having migraines, and it is due to post-inflammatory changes that can be addressed in different ways. All right, autoimmune disease. So this is what we see a lot in office. This image on the right-hand side is one of my favorite images to kind of explain why we're seeing autoimmunity and why it might be happening. So what we're seeing a lot is there's a new onset of autoimmune disease in someone that didn't know they had or didn't have any history of autoimmune disease. And this is the idea behind this, is that there's just such a strong immune system response to COVID that it's leading to activation of auto antibodies, auto meaning self. So these self antibodies leading to autoimmune disease. And this is what's really being implicated is this idea of molecular mimicry, meaning that there's pieces of the virus, of the COVID virus, that are mimicking the human proteins. So they look very similar, and it's causing the immune system to mistakenly target our self cells because they think it's part of the virus that it needs to go in and kill and get rid of. So what we're seeing a lot in office is elevations in these ANAs, and ANA meaning anti-nuclear antibodies. And these are antibodies, every cell in your body has a nucleus. If you go back to like basic 4th grade biology, every cell has a nucleus, and these antibodies are attacking the nucleus of the cells. It's kind of non-specific. If only ANA is elevated, it doesn't exactly tell us. It just means we have this undifferentiated connective tissue disease is what we have to kind of name it, because it's not causing issues in specific organ systems yet. We're seeing a lot of Graves' disease, a lot of PMR and lupus. And what we're also seeing is that those that have the elevations in the ANA are having more of those neurocognitive symptoms. So a lot more fatigue and brain fog. And so if we look over here at this picture on the right, we see that it's a spectrum of autoimmune disease. So over here on the left is just healthy, no autoimmune activation. And then we know there's lots of triggers. And so even though we know that COVID is triggering a lot of these autoimmune symptoms, there's also other things. Dietary proteins, other infections, including dysbiosis, or that imbalance in your digestive tract and in those microorganisms that are living there, chemical and heavy metal exposure, and then stress, because there's this cortisol piece that plays a role in autoimmune diseases. And a lot of times people are having these triggers for a long time and many years, and maybe don't know it. Maybe we don't know that there's an imbalance in our digestive tract, or that we're sensitive to certain foods that we eat, or even that we're being exposed to certain chemicals that could be causing issues. And so we're kind of moving into this pre-symptomatic phase. And what's really interesting is that maybe we don't know, in the literature, they talk about this a lot, that we don't know that the people that have new onset autoimmunity after COVID, a lot of times they haven't been tested before. So we don't actually know if it's because of COVID, it was the linchpin that like set you over and you're in this red symptomatic phase, or if people were kind of living in this pre-symptomatic phase where maybe you can see elevations in some of these blood markers, the ANA and the other antibody markers, and then it's just COVID pushing you into this area where you're having symptoms, and then you're getting tested. So it's kind of an unknown there, whether it was only COVID pushing people over here to this symptomatic phase, or if it was people over here, and you see where the curve starts to get high. So you could be lingering where in this area between dynamic system thresholds, so where we're seeing symptoms in the pre-symptomatic phase. So in like all autoimmune diseases, we're looking for the triggers. We know it's microbial, so we work on identifying microbial triggers, balancing hormones, working on stress and balancing cortisol being the most important things.
Right. So next, we're going to go into some protocols that you can have in your back pocket for preventing, it's really preventing the sort of worsening of symptoms, preventing a severe manifestation of acute COVID-19, and thereby preventing long COVID. So, you know, we didn't even really discuss talking about things like vaccination and masking in large groups and hand washing, just because all of that is so routine. But that is the sort of first line, is preventing getting the COVID-19 infection in the first place is what we want to do to prevent long COVID. But, you know, that all being said, um, COVID-19 is a very widespread disease, and it's good to kind of live your life and make health choices, assuming that you will get it at some point. So, some of the basics of our prevention protocol are really just supporting your body from the ground up. So, getting enough sleep. If you're having insomnia, reach out to your doctor or other kinds of care providers and get that addressed. Stress management is huge. Um, we've talked about cortisol a couple of times today, and it can really impact our immune system, as Dr. Stocker was explaining. Um, Sometimes, elevated cortisol can suppress our immune system. And when we're under periods of high stress, that elevated cortisol can actually um, impair our body's ability to fight off disease. Um, so, really, paying attention to um, having meditative grounding practices in your life, um, kind of finding a work-life balance, and finding ways to have a really good, robust daily routine are really important. So, dietarily, we really want to focus on eating the rainbow. So, there's so many different antioxidants and vitamins that we can get from colorful fruits and vegetables, from vitamin C, beta carotene, lycopene, um, folate, calcium, all of these things. And so we'll want to aim for 5 to 7 servings of vegetables and 2 to 3 servings of fruit on a daily basis. And some specific things you can increase in your diet that have been shown to be antiviral are garlic, onions, leeks, and shallots. So things that are Alliaceae family, and then the mushrooms. So shiitake, maitake, um, oyster mushrooms, chanterelles. These are all available in the Pacific Northwest and really great to include in just kind of sauteed or in soups and stews. So some of the vitamins that you may want to have on board supplementally include vitamin D. For this, you really want to make sure that your levels are sufficient. So we like to see it above 60, ideally, um, based on serum testing. And this is one that you can take too much of. So it is good to, if you are on a high dose of vitamin D, to get your levels tested and make sure it's not too high, because that can cause other problems. But a typical dosing for the Pacific Northwest that I find patients work well with is between 2,000 and 8,000 international units. And this is going to really depend on your sunlight exposure and diet and all of that. So we see that that vitamin D facilitates the production of antimicrobial peptides in the respiratory epithelium, and it does it plays a widespread variety of roles in our body to kind of keep everything functioning. We also see that vitamin K has been, or sufficient levels of both vitamin D and vitamin K have been shown to lead to better disease outcomes with COVID-19. A typical dosing for vitamin K is 25 to 50 micrograms. Vitamin K is required for normal blood clotting, and it can help modulate cytokines like IL-6, which is one of the major ones involved in the COVID-19 acute phase. And then we also have vitamin A. We don't recommend doing more than 10,000 IUs of vitamin A. This is another one that is fat soluble and can accumulate into high amounts and cause toxicity if you take too much of it. But it can help prevent infection by modulating the immune system and providing an anti-inflammatory effect. One thing to note is we're providing some basic guidelines for dosing, but they are not appropriate for everyone. So if you're pregnant or lactating or have chronic kidney conditions or other chronic health conditions, it's good to talk to your doctor about what dosing is appropriate for you. So next we also have vitamin C. This is, you can find this in a variety of foods, but when you're really kind of going for a prevention protocol, it's a good idea to take 1,000 milligrams supplementally per day. And you may consider doing liposomal vitamin C for better absorption. It's packaged in these kind of fatty lipids that help with absorption in the gut lining. So vitamin C can really help protect against oxidative damage. So during the kind of elevated, or what we were calling the cytokine storm, the elevated inflammatory markers and this kind of influx of immune cells into our various organs, this can cause what are known as free radicals or kind of unpaired particles that can cause damage to our cells. And these antioxidants like vitamin C are good at grabbing those unpaired electrons and shuttling them into its molecular structure to prevent further oxidative damage after an inflammatory event. Vitamin C also can help stimulate white blood cell production and function, and it's more effective when taken with zinc. We'll discuss that in a little bit. Vitamin B6 is our last vitamin here. Typical dosing is 25 milligrams, and this can also help reduce pro-inflammatory cytokines, which has to do with the conversion of fatty acids to produce those cytokines. So some minerals to think about include zinc. So this functions with vitamin C to promote the healthy immune system function and production of immune cells. And then we have selenium that can help lower oxidative stress. It's involved in the production of glutathione and other antioxidants that function in the particularly respiratory mucosa. And again, we'll discuss more on NAC and glutathione in a little bit here, but that's part of that system. So next, we're going to discuss the acute COVID protocol. So this is when you are positive with COVID-19 and you really want to ramp up your self-care and antiviral strategies. So the timeline for this is going to be generally about 2 to 4 weeks, depending on the severity of your illness. And you may want to consider continuing it longer. So Dr. Stocker will discuss that later in the post-COVID protocol. But as I go through this, a lot of these things that I'm going to discuss are rather intuitive. What do you do when you have a cold, for instance? And we want to think about the progression to long COVID in a way that we're still considering ourselves sick. So, if symptoms are progressing beyond 4 weeks and you're still struggling with fatigue or any of these symptoms we've been mentioning, don't just go back to your normal life and expect yourself to function at top speed Some of us don't have that luxury, but it is a good thing to think about that often you'll need to give yourself more grace and more time and just consider yourself still ill. So, some of the things you can do again are really rest and take time to rest, um, ramping up your sleep, and you may even want to consider 1 to 5 milligrams of melatonin. That has been shown to have improved COVID-19 outcomes. We were finding that early on in the pandemic. And we also really want to practice stress management. And when it comes to diet, here you want to ramp it up and you want to avoid all refined sugar and then really have minimal refined carbohydrates and dairy. And then avoid heavy, fatty, and fried foods and really focus on things like soups with clear broth. Here's some ideas of things you can mix in to like a chicken broth or a vegetable broth. You may want to consider things like miso and then antiviral herbs like ginger and garlic, and then antiviral foods like mushrooms and carrots and scallions. Um, so that kind of eating light foods that are not going to tax your digestive system is really important in the healing process. And then you want to increase your citrus intake for vitamin C. So some of the things we can do for antioxidant support, again, this is knowing that we're going through this oxidative event where our immune system is releasing a lot of these chemicals that cause free radical formation. And so we want to include a lot of these things in our diet and in our supplements that are helping mitigate that damage and preventing long-term structural damage. So this is going to include N-acetylcysteine or NAC. This is a mucolytic, so it helps break up mucus if you're having a lot of sinus congestion during COVID. And it's also a precursor to glutathione. So thereby it is antioxidant, anti-inflammatory, and immune modulating. Now, glutathione is considered the master antioxidant, and it's involved in many processes. So in each cell, it's involved in detoxification. Um, it, it can prevent things like protein misfolding that can happen during this inflammatory event. It provides antiviral defense and can promote the immune response or kind of modulate the immune response. We also see that, again, it's going to neutralize those free radical oxygen species that are produced in the immune response as well. And glutathione is known to specifically help with the respiratory mucosa. We also have quercetin as one of our heavy-hitting antioxidants. That's also anti-inflammatory and immune modulating. It's found in a lot of different foods and herbs like nettles, and you can also get it in a supplement form, in an extract form. So next here we've got our major antiviral herbs. Andrographis is one used in many traditional medicines like Chinese medicine and Ayurvedic medicine, and it's a very strong, in Ayurvedic medicine, it's known as the king of the bitters. It's a very strong antiviral, antioxidant, anti-inflammatory herb that in Chinese medicine is known to clear heat. So when you have an infection, it causes what we call a lot of heat production in Chinese medicine. And so this is an incredibly cooling, kind of heavy-hitting antiviral herb. Next, we have astragalus. This is more of a tonic that is supportive to the immune system, kind of ongoing, and you can take it more long-term. And it is known as more of an immune modulator. So, and it's kind of mildly antiviral, but it is working with the immune cells to prevent them from overreacting and to support their kind of even function. Next, we've got lemon balm. This is also a more gentle antiviral, anti-inflammatory, and also is known as a nervine. So can be really calming, especially if you're having any kind of post-COVID anxiety or having anxiety during an acute COVID, when you're actually in the acute COVID phase. And then lastly, here we've got licorice. This is also good during an acute COVID phase because it is antiviral and it's also anti-inflammatory. So it's got glycyrrhizin, which acts as a glucocorticoid or cortisol-like molecule that will affect our immune system by kind of slowing it down. So again, when we're trying to prevent that overreactivity of the immune system in response to COVID-19, this is a really helpful one. All right, Dr. Stocker is going to bring us through the post-COVID protocol.
Yeah, so the post-COVID protocol is going to be very dependent on symptoms that you're experiencing kind of long term. So it's going to be very much tailored to kind of what you're actually experiencing. Generally, we're recommending that you continue with any acute protocol for at least 2 weeks after your acute symptoms have subsided. So you're feeling a little bit better, but continue with all those things, especially, like NAC and quercetin are my top two. If you're going to have to pick two out of those, continuing with those two. And then we're going to kind of go through what some areas that we see most often. So with digestion, we're often seeing people have more diarrhea or constipation, gas and bloating, and abdominal pain. So it's really important to increase your pre and probiotics. So these are foods that the prebiotics are going to be foods that the bacteria like to eat. So these are things like artichoke, and other fibers. So fibrous foods like psyllium, acacia fiber, and things like that. And this is going to do twofold. It is going to increase the microbial diversity. So it's going to increase the beneficial bacteria in your GI tract and hopefully decrease the amount of opportunistic or bad bacteria that are in your GI tract. That being said, sometimes you need a little bit more support, and we need to go into addressing the exact dysbiosis, and that can include doing different things like antimicrobial herbs or antibiotics, kind of depending on each person's symptoms. And we do this, Dr. Schroder already talked about stool testing, but doing stool testing, and we've been seeing just a lot of changes in kind of odd bacteria pop up in people that have post-COVID syndrome. And then another thing, well, we talked a lot about this with the NAC and the glutathione, but we know that COVID is affecting people's livers. I would say on people that I'm testing liver enzymes on, at least 75 to or more have increased liver enzymes following COVID. And this can persist. Sometimes we see it going down, and sometimes it's just kind of persistently elevated. So that just means that the liver is having a little bit of a harder time in its function to detoxify. So it's really important to do things that are going to support your liver, things like castor oil packs, and that's applying castor oil over the area of your liver, which is from on your right side, approximately under your breast or pec, and then down to the bottom of your rib cage, and then continuing the NAC because it's really important to have the liver enzymes functioning properly. If you're having a lot of these neurocognitive symptoms, you need to, like Dr. Schroder was talking about, to continue to rest and to give yourself that time to completely heal. We want you to support your vascular system, so that's increasing these compounds called polyphenols, which support that endothelial layer. And these are things like dark berries, vegetables, nuts and seeds, healthy foods like that. There's also, I'm going to just be a proponent of artichoke in general because it's both a prebiotic food. It makes your liver really happy, and it also protects the endothelial layer. And it's really good to prevent any damage to the vascular system. There's also assessing the cortisol levels and giving some support if you need to do some cortisol support. We can use nervines to help people sleep and give support. And so these are different things like passion flower and valerian, milky oats, bacopa, and skullcap. Both the American skullcap and Chinese skullcap can be both anti-inflammatory and to support your nervous system and your nerves and the nervous tissue in general. And then if you're having a lot of symptoms like depression and anxiety post-COVID, increasing vagal tone seems to help a lot. And this is doing kind of odd things if you're going to go and splash cold water on yourself all the time, but it does help reset your vagus nerve, which is really responsible for modulating your autonomic nervous system. You can also hum or sing, and getting into tones like that Om tone during chanting is also known to stimulate the vagus nerve. Or there's things that you can do to actually directly stimulate your vagus nerve. And there are little devices that you can attach to an area in your ear where the vagus nerve has a branch. There's also acupuncture and electroacupuncture to points in your ear that can directly stimulate the vagus nerve, which have been studied and shown to improve depression and anxiety symptoms post-COVID. And then the endocrine system. So it really depends on where we're seeing symptoms. We're going to just keep repeating that, like it just depends. So there's things that like adaptogenic herbs, and adaptogenic herbs work on balancing your adrenal glands. It will help support the production of cortisol if it needs it, or modulate it down if you have too high of levels of cortisol. And this is just a list of herbs that we generally like to use. Pregnenolone is one that we often use too. It is a hormone precursor. So we know that pregnenolone can kind of go into this cascade of hormones, and it helps make reproductive hormones like estrogen, testosterone, and progesterone, but also helps the production of cortisol. If we're seeing changes in the reproductive system, doing things like seed cycling, which are eating certain seeds at different points in the cycle, that will help support the production of estrogen and to support the production of progesterone. And then, of course, chaste tree, which is kind of our master herb that helps support the production of those, especially female sex hormones, so estrogen and progesterone. And then direct thyroid support. Dr. Schroder already spoke about it, selenium, but a particular form of selenium called selenomethionine has really been shown and studied for a long time to be able to decrease thyroid antibody levels. And then eating L-tyrosine-rich foods to make thyroid hormone your body needs L-tyrosine. So increasing foods like pumpkin seeds, almonds, avocados, and sesame seeds can help your body's production of thyroid hormone.
Right. So many of us have heard of this symptom of the loss of smell and taste after COVID. It's one of the more disturbing symptoms out there. And while it is recovered in the vast majority of patients, sometimes there are some people who have had an ongoing lack of sense of taste and smell. So one of the things that you'll want to consider is, if you're having this long term, is acupuncture. We have seen in multiple studies an improvement with post-viral anosmia. In one study, it was over a 10-week treatment period. This is just to note, these studies were done on post-viral anosmia related to other viruses, not COVID-19. So these were conducted prior to the COVID-19 pandemic. One thing to note here is that the earlier you start this type of therapy, the better. So if you're struggling with the loss of taste and smell, getting going with an acupuncturist earlier on, after the onset of those symptoms, is a good idea and likely to be more effective.
Okay, and another thing you can do at home to try to help restore some sense of smell is smell retraining. There's been lots of studies on this in people with anosmia after COVID. And the idea is to gently smell different essential oils for at least 20 seconds. And you're going to try to, the scent and you have memories. So you think about smelling the same thing. Think about smelling a rose if you're using rose essential oil. And you do that to try to retrain your olfactory nerves, which are these nerves that come down into your nose and go to your brain to tell you what you're smelling. And so this has to be done for long term. So it's you're smelling different scents for about 20 seconds, up to twice per day. And this can be long term, up to 4 to 6 months, or until your smell returns. The common scents that people that have been studied have been rose, lemon, clove, and eucalyptus. But really, it's just up to you to pick the scents that you enjoy and like to smell. And then finally, hyperbaric oxygen therapy. So a lot of these treatments have not been studied, but when we come to like science, the most evidence-based studies we can have are randomized control studies. So this is kind of an exciting study because it was a randomized control study. It was on a small number of patients, only 73, but it's pretty good considering the lack of studies out there on treatments for post-COVID syndrome. And so in this study, they took 73 people with post-COVID syndrome, and they treated them with hyperbaric oxygen therapy. And in the treatment arm, they gave them real hyperbaric oxygen therapy. And in the control arm, they thought they were getting hyperbaric oxygen therapy, but were not actually being pressurized to get that treatment. And in the treatment arm, they showed that most people had an increase in global cognition. So those neurocognitive functions that we talked about of fatigue and brain fog were improved. Energy and the ability to sleep better were improved. Symptoms of anxiety, depression, agitation, and pain all decreased. So they think their hypothesis is that the hyperbaric oxygen therapy may just be causing an increase of oxygen and brain perfusion and increasing neuroplasticity in the areas that are responsible for cognition and the emotional changes seen in post-COVID syndrome.
Right. So we're nearing the end of the talk now, and I just want to address, many patients are kind of not, or seem to be unclear about when to seek help for this kind of condition. Do I wait until the 4-week mark? Do I come in 2 months later? And the answer is, you can come in prior to getting being positive for COVID. That's a great time to strategize based on your risk factors. Get any baseline testing, thyroid, hormone, all the digestive function testing. And then, when you are positive for COVID-19, we wouldn't have you come into the office, obviously, but we have telemed appointments available. And it's a really great time to reach out because, when you're getting really hit hard with the virus, it's helpful for someone to just give you the treatment plan that you need to do and get you set up with the right supplements, and, discuss any supplements and pharmaceuticals you should be taking. And then lastly, you should come in again if you experience symptoms after the COVID-19 infection that lasts for longer than 2 weeks. That's when we're starting to think about COVID, long COVID, and then after 4 weeks is when it's kind of more clearly defined as long COVID. So that's another time as well. And as we've emphasized throughout this doc talk, each person is going to have a very different picture when it comes to long hauler disease. And so it's great to bring in prior labs that you've had, and, you know, kind of have your baseline labs and then have us kind of figure out what we need to test after the fact to get to a better understanding of what part of your system has been disrupted. So I hope that this Doc Talk was informative and helpful for all of you. Again, if you are experiencing any of these symptoms or need support pre, during, and post COVID-19, give us a call and set up an appointment. Here's our phone number. And you can also email us at info@ariaintegrative.com. And we're here for naturopathic medicine, blood work, traditional Chinese medicine, and a number of other things. All right. So I hope you have a great rest of your day, and stay tuned for our Doc Talk in October. We'll be discussing acupuncture and its benefits for pain management.